Most people have no idea, but the way you sleep tonight could quietly be raising your stroke risk while you lie there doing nothing about it. One sleeping position in particular is putting real, measurable pressure on your blood flow, and the older you get, the more that pressure matters. In the next few minutes, I'm going to show you exactly which position doctors warn about and how to fix it before it costs you something you can't get back. If you sleep on your right side, stop. Right now. I mean it. That position you think is comfortable may be slowly choking off blood flow to your heart every single night for years. And here's the part that should unsettle you. As a cardiac surgeon, I can tell you that 30% of all strokes happen between midnight and 6 a.m., not during a stressful meeting, not during exercise, while you're asleep, defenseless, unaware. I'm Dr. Adewale Morgan, and over the next 15 minutes, I'm going to walk you through 5 sleep positions, ranked from bad to genuinely dangerous. Then I'm going to hand you 2 positions that can actively protect your brain starting tonight. Before we go further, I want you to do something. Comment below. Back sleeper, side sleeper, or stomach sleeper. Because in the next 60 seconds, I'm going to tell you if your habit belongs on this list. And if you're over 60, understand this. What I'm about to show you is no longer optional. Let's begin with number 5, sleeping completely flat on your back with 0 elevation. I understand the appeal. Your spine feels straight, disciplined, correct. But here's what your body is actually doing when you lie perfectly horizontal, especially past 60. Blood pools toward your head. Gravity stops being your ally and becomes your adversary. In your 20s, your vessels are elastic enough to absorb this. Past 60, they stiffen. The small arteries feeding your brain grow fragile. And when blood sits in your skull for 7 or 8 hours without proper drainage, pressure builds. That pounding headache at 3 a.m. isn't bad luck. That's intracranial pressure. Your brain is being squeezed by blood volume with nowhere to go. Research published in the Journal of Clinical Sleep Medicine confirms this directly. Even a modest 15-degree elevation of the head meaningfully reduces that pressure and restores proper venous return to the heart. Here's the pattern I see in men who ignore this. They wake up dizzy, sit up too fast, feel the room tilt, and tell themselves, it's just age. It isn't. That's your circulatory system sending you a warning you're choosing not to hear. I'll give you the exact fix at the end, but first, number 4 will surprise you. Number 4, sleeping on your right side, if you carry any history of heart trouble or high blood pressure. Sounds oddly specific, but the anatomy backs it up completely. Your heart sits left of center in your chest. Lie on your right side, and your body weight shifts against one of the largest veins you have, the inferior vena cava, the vein responsible for returning blood from your entire lower body to your heart. Even mild compression forces your heart to work harder to pull that blood back in. For a healthy man in his 30s, negligible. For a man past 60 with borderline heart function or elevated blood pressure, your heart is already carrying a heavier load than it should. Add 7 hours of extra strain to that every single night. Cardiologists have observed this repeatedly. Patients with heart failure instinctively avoid the right side. Their body rejects it before their mind understands why. That discomfort is data. The European Journal of Heart Failure studied this directly and found left side sleeping correlated with more stable blood flow and less overnight cardiac strain. Picture a man who's managed his blood pressure responsibly for years, medication steady, numbers controlled, but who sleeps on his right side out of habit. No dramatic symptoms, but his heart compensates night after night, decade after decade. That cumulative cost never shows up on a daytime reading. It shows up as a stroke at 4 a.m. If you commented right side sleeper, stay with me. Number 3 might hit even closer to home. Number 3, stacking 2, 3, even 4 pillows under your head. Men do this thinking it helps with breathing, reflux, sinus drainage. And yes, some elevation genuinely helps. But here's what excessive stacking does that no one talks about. Your neck bends forward, not slightly, dramatically. Running along both sides of your cervical spine are the vertebral arteries, the vessels responsible for supplying your brainstem and cerebellum, the regions governing balance, coordination, consciousness itself. Push your head too far forward with stacked pillows, and those arteries get compressed. You won't feel it happening. But chronic compression, night after night, quietly reduces oxygen delivery to critical brain structures. That stiff neck and dull ache at the base of your skull each morning. Not muscle tension, restricted blood flow. The Journal of Manipulative and Physiological Therapeutics examined how neck flexion affects vertebral artery blood flow, and extreme forward bending measurably reduced it. That wasn't a sleep-specific study, but the principle transfers directly. Put your neck in a compromised position for 8 hours a night, and the cost compounds. I've seen the pattern over and over. A man wakes up daily with neck pain and a headache, chalks it up to stress or age, switches to a single properly contoured pillow. And within a week, it's gone. One pillow. That's the discipline required, but we're still not at the worst of it. Number 2, sleeping curled tight in the fetal position. Common, especially among older men. It feels safe, protective, instinctive. Physiologically, it creates 2 real problems. First, your lungs cannot fully expand. Knees to chest, chin tucked. Your rib cage compresses, and every breath you take all night is shallower than it should be. That tightness in your chest when you wake and can't take a full breath right away, that's hours of restricted lung capacity catching up with you. Drop your oxygen intake even 10 to 15%, and your blood oxygen saturation falls with it. For a man carrying cardiovascular risk or early lung issues, that reduced oxygenation stresses both heart and brain simultaneously. Second, your neck and upper back sit under constant tension. Muscles stay contracted. Small vessels near your cervical spine and skull base get compressed. Blood flow to your brain drops. Studies in respiratory physiology confirm that significant spinal flexion reduces tidal volume, the air you pull in per breath, and across a full night. That shortfall adds up to hundreds of shallow breaths. A man wakes foggy, maybe a dull headache, a little unsteady. He tells himself he slept poorly. In reality, his brain went hours underfed on oxygen. I'll show you the fix shortly. But number 1 is where every risk factor on this list collides into a single dangerous habit. And if this is you, it stops tonight. Number 1, going to bed within 2 hours of a large meal or a drink. I know this cuts close for a lot of men. Late dinners, a drink to unwind. It's woven into how we live. But cardiovascularly, this is the most dangerous combination on the entire list. When you eat a heavy meal, your body redirects blood toward digestion. Normal, but it means less blood available for your brain, heart, and other vital organs. A younger body compensates easily. An older man with narrowed arteries can experience dizziness, lightheadedness, even fainting during sleep from this redistribution alone. Now add alcohol. Alcohol dilates your vessels, drops your blood pressure suddenly. In a man with flexible, healthy vessels, that just feels relaxing. In a man with plaque buildup or stiffened arteries, that sudden drop triggers a compensatory overcorrection. Pressure spikes, then crashes again. These violent swings stress vascular walls, weaken them, and can lead to rupture. In zones where blood flow turns erratic, clots form. All of this while you're unconscious and unable to respond. The American Journal of Hypertension studied alcohol's effect on nighttime blood pressure and found that even moderate drinking near bedtime disrupts the normal pressure dip your body needs during sleep. When that dip fails to occur, cardiovascular strain climbs sharply. Picture it. Dinner at 8 o'clock, 2 drinks, asleep by 10 o'clock. At 2 a.m., he wakes with a pounding head, racing heart, sweat-soaked sheets. He calls it a bad dream. It isn't. That's a circulatory crisis his body is fighting silently. These episodes accumulate. Small vessel damage, microstrokes he never notices, until one night it's no longer micro. If you take one thing from this video, take this. Finish dinner 3 hours before bed. If you drink, stop 4 to 5 hours before sleep. After dinner, walk for 15 minutes. Movement alone. This single change can cut your overnight stroke risk more than most medications ever will. Now, the 5 to avoid are behind us. Here is what you build instead. Position 1. Left side sleeping. And I'll tell you something most physicians never explain clearly. Your heart sits left of center. Sleep on your left side, and gravity finally works with you instead of against you. Your heart works less. Circulation improves. Your brain receives more oxygen. That's basic cardiology. But here's what changes everything. Roughly a decade ago, researchers identified something called the glymphatic system. Think of it as your brain's waste management crew, working while you sleep to flush out toxins and metabolic debris, including the proteins linked to Alzheimer's disease. A study in the Journal of Neuroscience found this system operates most efficiently when you sleep on your side, particularly the left. Every day, your brain accumulates proteins like amyloid beta and tau. In Alzheimer's patients, these proteins build into plaques. In a healthy brain, the glymphatic system clears them out overnight, but sleep in a position that restricts that clearance, and those proteins begin accumulating. Not overnight, over years, over decades. By the time symptoms surface, the damage is already done. Left side sleeping optimizes that clearance. This isn't only about preventing a stroke tonight, it's about protecting your cognitive sharpness 20 years from now. There's a secondary benefit too. If reflux disrupts your nights, the anatomy of your stomach and esophagus means left side sleeping keeps acid where it belongs. No burning in your chest at 2 a.m. If you've spent 30 years sleeping on your right side or your back, this requires real adjustment. Here's the practical fix. Get a body pillow. Hug it in front of you. It anchors you left, supports your spine, and if joint pain is an issue, place a smaller pillow between your knees. The most common question I get, what if I roll over in my sleep? You will. That's normal. The goal isn't perfection. It's spending more of the night in the optimal position than the harmful one. Position 2, for specific men, back sleeping with a gentle incline. Not flat, not upright. A gradual 15 to 30 degree elevation achieved with a wedge pillow, an adjustable bed, or carefully arranged pillows. The key is that your entire upper body rises, not just your head. 3 reasons this works. First, blood returns to your heart more efficiently from your lower body. Critical if you deal with poor circulation, swollen ankles, or varicose veins, since it means your cardiovascular system does less work overnight. Second, pressure inside your skull drops. For men with fragile brain vessels or uncontrolled blood pressure, this lowers the risk of small vessel rupture, the kind of tiny hemorrhage that produces no dramatic symptom in the moment, but accumulates over years into memory issues and vascular dementia. Third, your breathing improves. Your airway stays more open, which reduces snoring and improves oxygen delivery if you deal with mild sleep apnea, congestion, or sinus trouble. Here's the detail most men miss. If you elevate your upper body, place a small pillow under your knees as well. This preserves your spine's natural curve and takes pressure off your lower back, creating what's called a zero-gravity posture, the same principle NASA studied for astronauts, distributing pressure evenly and reducing strain on both joints and vessels. But I'll be straight with you. This isn't universal. Severe sleep apnea can collapse your airway even with elevation. Left side sleeping is the better call there. Shoulder arthritis may find relief here. Heart failure usually favors the left side. The goal isn't blind rule following. It's understanding the mechanism so you can apply it to your own body. Tried either of these? Tell me in the comments. Left side or elevated back. I want to know what's working for you. Now let's talk about your bedroom, because even the correct position won't save you if the environment around it is working against you. Your bedroom isn't neutral ground. It's where your brain and heart either recover or slowly deteriorate. Start with temperature. Keep the room between 64 and 68 degrees Fahrenheit. A cool environment lets your core temperature drop, which triggers deep sleep and naturally lowers nighttime blood pressure, easing strain on brain vessels. Run it too warm, and your body burns energy regulating heat instead of resting. You stay stuck in lighter sleep stages, heart rate elevated, never reaching the deep recovery phase where real repair happens. Next, cut blue light after 9 p.m. Phones, tablets, harsh overhead lighting. All of it suppresses melatonin and delays the deep sleep stages where your brain clears waste and your cardiovascular system stabilizes. If a device is unavoidable, use blue light blocking glasses or night mode. Better yet, pick up a physical book. Give your mind real wind-down time, free of screens. Third, proper neck support. We already covered pillow height, but it bears repeating. Memory foam with cervical contour, Support your neck's natural curve without forcing your head into unnatural angles, and this alone can prevent restricted blood flow through the vertebral arteries. Finally, noise. Sounds that don't fully wake you still jolt you out of deep sleep. Your heart rate spikes, cortisol rises. These are micro-stress events you won't remember, but your vascular system will. A white noise machine or earplugs create a consistent sound backdrop that masks the irregular noise disrupting your recovery. None of this is optional polish. These are variables directly tied to your stroke risk. If you want to go further, start tracking your nighttime physiology. Your body signals you constantly while you sleep. Most men simply never learn to read it. First, an overnight pulse oximeter, a small finger clip that tracks oxygen levels through the night. Oxygen repeatedly dropping below 92% is a red flag. Sleep apnea, poor circulation, respiratory trouble, all of which raise stroke risk. That data is worth bringing to your doctor, especially if you're experiencing unexplained symptoms. Second, heart rate variability tracking, available through most smartwatches or sleep rings. HRV reflects how well your autonomic nervous system is functioning. Low overnight HRV signals stress, inflammation, blood pressure issues, or metabolic dysfunction, an early warning that your body isn't truly recovering while you sleep. Third, keep a simple sleep journal. Note how you feel each morning: headaches, dizziness, numbness, tingling, brain fog. These subtle signs can point to poor oxygenation or restricted circulation overnight, and the patterns you record help both you and your doctor catch what a single office visit never would. Understand something critical. These tools are for awareness, not diagnosis. They do not replace medical evaluation. If patterns concern you, if symptoms persist, if you carry stroke risk factors, take this to a qualified physician. Self-monitoring has real value. It is not a substitute for professional care. What these tools give you instead is data, control, clarity. You stop guessing. You start measuring. Here's why almost nobody has told you any of this. Sleep position doesn't fit neatly into a standard medical appointment. There's no blood test for it, no imaging study, no prescription pad involved. In a 15-minute visit, your doctor is reviewing labs, adjusting medication, addressing whatever's acute. Sleep posture never makes the list. But the research is unambiguous. Certain sleeping positions quietly affect blood flow, oxygen delivery, intracranial pressure, and your brain's capacity to clear toxic proteins. None of this arrives as a dramatic event. It builds night after night, year after year. For any man past 60, for anyone managing blood pressure or cardiovascular risk, these habits stop being trivial and become critical. And here's the part that should energize you rather than alarm you. You don't need a prescription. You don't need an expensive intervention. You need awareness and 1 or 2 deliberate adjustments. Shift to left side sleeping. Elevate your head 15 degrees. Stop eating within 2 hours of bed. Swap 3 stacked pillows for 1 properly contoured one. Any single change here can measurably improve how your cardiovascular system functions while you sleep. You're not just cutting stroke risk. You're investing in brain longevity, cognitive clarity, and cardiovascular strength for the next 20 to 30 years of your life. By watching this to the end, by taking the time to understand these mechanisms, you're already more informed than 95% of men your age. You are taking direct control over variables that are entirely within your power. You now know something most physicians won't raise in a routine visit. That knowledge can protect your brain starting tonight. That is not a small thing. That is significant. Here's your assignment. Pick one adjustment from everything we covered. Maybe it's left side sleeping. Maybe it's finishing dinner 3 hours before bed. Maybe it's switching to a single contoured pillow. Start there. Commit to 7 days. Pay attention to how you feel each morning. Notice whether the headaches ease, whether your energy climbs, whether your mind feels sharper. Your body will tell you if it's working. Now comment below. Which habit are you changing first? Your answer might be exactly what another man needed to read today. If this gave you information you'd never heard before, hit like and send it to someone who needs it. Someone over 60, someone managing blood pressure, someone who keeps waking up with symptoms he can't explain. And here's why you subscribe right now. Next week, I'm laying out 5 specific foods clinical research shows can cut stroke risk by up to 30%. Not vague advice, exact foods, exact amounts. And here's the part that'll get you. You probably already have 3 of them in your kitchen, and you're not using them correctly. This is research most men will never encounter on their own, information that won't come up in a routine checkup, but it could genuinely change the trajectory of your health. Hit subscribe, turn on notifications, because if today mattered, next week matters more. Until then, sleep with discipline, stay informed, protect your mind. I'm Dr. Adewale Morgan. I'll see you in the next one.